EVS is the frontline defense for infection control. And I don't think it happened or the awareness was created until we saw what happened 2 years ago with Ebola. Then that woke everybody up in terms of saying, this is the importance of these professionals and what they do for the hospital. Well, today we have a different challenge in terms of a new disease, and this is going to unfortunately be with us forever in terms of emerging diseases or pathogens. And
those processes, but we did have a patient that came in, and it was an elderly gentleman, and he did pass away within 3 days of assessment while he was in RED. However, so overall we pulled 111 employees in to be tested for exposure of the Zika. At that time, as we went through, there were 72 that were identified as who had direct contact. However, the patient's son was diagnosed as being positive for Zika. Our epidemiologist was looking at smaller systems that the amount of wet waste and waste that an Ebola patient produces is huge. There would be no, portable type of an autoclave that could handle that.
Your hospitals, go back 3 years ago, and raise your hand I'll student affirmative if you think your hospital was prepared for a random patient to walk in that had Ebola. Healthcare Coalition for Emergency Preparedness evolved out of a need to look at things that weren't being considered under general emergency preparedness plans by hospitals, states, Department of Health, and basically by HHS and ASPR on what they were funding. Influenza. A rate of 40% of the population could be out of work in a 1918 style influenza pandemic. Okay. If your vendors are going to show up, if your hospital has overrun with influenza patients? Are their workers going to show up to do what you need them to do? Everybody's saying, it's okay. Every hospital knows how to treat Ebola. You can send an Ebola patient to any hospital. Bring them on in. They didn't think about the waste aspect. They couldn't get anybody to haul the waste. So they finally figured out, they got the DOT waiver, they figured out how to package it. Now no one will take the waste. So they have to ship it to Texas. At the cost of, anyone know the answer? Not you. Anyone know the answer? $100,000 a day.
Oh my word.
To ship waste from New York City to Brownsville, Texas to be incinerated.